Burns are common injuries in children and can range in severity from minor to life-threatening. Sunburn is the most common type of burn injury in kids. However, burns may occur from many household appliances. Infants and young children have very sensitive skin and are easily burnt from hot bath water and cooking food. So what are the major sources of burns in children? Heat obviously causes thermal burns, and some sources of thermal burns in the home are from the fireplace, from a clothes iron, from stoves, hot bath water, or soup on the stove. Radiation burns may not be noticeable until after the damage has occurred, and some sources are sunburn, tanning beds, or radioactive material. Electrical outlets in the home are a major hazard to curious toddlers with paper clips. Examples of electrical burns are those from electrical outlets, down power lines, or lightning strikes. Chemical burns occur due to poisons around the house. If a toddler drinks a poison, such as a drain declogger or other chemical, it can cause severe burns to the inside of the mouth and the esophagus. Some examples of chemicals to look out for are household cleaners, battery acids, or any lye-containing products. So how is the severity of a burn classified? Well, a first-degree burn is the mildest of burns, and this is the classic mild sunburn. The skin turns red and hurts. Only the outer layer of skin is affected, and blisters and swellings do not occur. This type of burn heals over a few days without scarring, although skin peeling may occur as the burn heals. Second-degree burns are also called partial thickness burns. Like a first-degree burn, the skin turns red and hurts, but blisters and swelling also occur. Both the external layer of skin, the epidermis, and the deeper layer of skin, called the dermis, are affected. Some scarring may occur with severe second-degree burns. Blisters occur because inflammation in the deeper cells release fluid under the outside layer of skin. Third-degree burns are called full-thickness burns because all the skin layers are severely affected. Surprisingly, third-degree burns may not hurt because nerves in the skin are destroyed. Blood vessels and glands are also destroyed. The risk of complications is high with this type of burn due to the loss of the normal skin barrier. Fourth-degree burns are the most severe type of burn, and not only is the skin destroyed, but also deeper tissues such as muscle, bone, and the body's organs. So what are the complications of burns? The larger and deeper a burn, the higher the risk of complications. Infection, without the skin barrier, bacteria can enter the body easily. Loss of water. Skin normally keeps excess water from evaporating. Loss of protein and electrolytes. Inflammation in the damaged skin may cause important proteins and electrolytes to leak out of the bloodstream. And loss of heat, because the skin helps the body retain heat. So how are minor burns treated? Well, the first goal of treating a burn is to remove the offending agent. After removing the source of the heat, or the burn source, wash the area with warm water. Creams, ointments, oils, butter, and other agents should be avoided. It is often difficult to determine the extent of a burn until after several hours after the injury. This is difficult even for doctors. Antibacterial ointments may be used for small minor burns after the burn is cleaned. Large and deep burns should always be evaluated by a doctor. So how are severe burns treated? Well, burns in young children, large burns, and deep burns should be evaluated by a doctor every time. It is important to assess the extent of the burn quickly to determine the risk of complications. When the skin barrier is broken, even small burns can cause serious problems such as infection or dehydration. So what about electrical burns? Burns by electricity may appear mild on the outside while severe damage is hidden underneath the skin. Electricity may also damage the internal organs or cause an abnormal heart rhythm. What about chemical burns? It should be determined if any of the chemical was inhaled or swallowed. If this occurred, then the child should be checked for internal damage. When corrosive chemicals are swallowed, severe damage may occur to the esophagus or lungs. This type of internal damage may not be noticeable for several hours or days after the injury. This has been Dr. Michael Davis. For more information on this and other kids' health topics, please visit our website at healthykidtips.com.